So my name is Carolyn Fowler and I'm the Director of Nursing Quality for NCH&C, Norfolk Community and Health Care Trust. We are a community trust which includes community nursing and therapy, includes a number of wards. We've got 12 wards over Norfolk, spread out from Holt to Swaffham, Dereham, Ogden, Kelling, obviously North Walsham. We've got some specialist services, so stroke, specialist palliative care, neurology. We have children's services, we have learning disabilities, and a number of specialist services like epilepsy. So we've got over 70 sites around Norfolk serving the population.
The scope of what you deliver is absolutely vast. So it's hard to put it into a nutshell, but you've done well to do so there. I guess kind of considering the amount that you're responsible for in the community, how has provision been most kind of dramatically impacted by COVID-19, and what measures have been introduced to try and adapt and meet the scale of the problem, really?
COVID-19's had, as you can imagine, a number of impacts for us. One of the key roles we've had is to help discharge, so to help discharge from the acute units so that they can manage our more poorly patients with COVID. So we've been setting up 7-day hubs, 8 till 8, working with primary care. So we've got GPs on site, therapists, with Norfolk County Council, which have worked really, really well to ensure that we can as efficiently and effectively as possible discharge patients safely. We've increased our beds so that we can take more patients. We're supporting more patients in our beds as we wait for them to be at a position that they can go back to, say, care homes. It's impacted our community services. We've had to change some of the way we run our services. So rather than people coming into clinics, we might be doing virtual clinics. And we've set up some excellent consultation resources for patients who a lot have really, really liked and would like to continue to use, because they are in their own home, which makes them comfortable. It's not right for everyone. So we, where possible, prioritise people and look at the people that need our contact. We still visit people at home, but we think very carefully about that. We are identifying anyone that's shielding when we're going in. We do a risk assessment on every visit we do to see whether they are suspected or have COVID, and we have followed national guidance around our personal protective equipment.
I was just thinking about that. You mentioned the digital resources there. Is there kind of scope for you guys to take some of that forward? Have the patients received that well? Yeah.
So there's definitely an opportunity to use our learning and certainly look at the technology we've used. We've very quickly put through some really great technology that we were talking about, but we will manage to get, actually up and running. So some of that is consultations, where patients can actually go on our website and they click a button and it automatically takes them into their consultation. That's completely private. We've gone through all the right information governance, so patients can be assured that it's a confidential service. We're also looking at, wider use of this around things like telemedicine, which is more around actually people being able to do some of their basic observations at home, maybe take their blood pressure, things like that, and then feed that through into the consultation. So it's making things effective and efficient, but it's also giving patients perhaps a little bit more control over what's going on for them. And hopefully if they like that service, we can use that so they don't have to drive for half an hour. They don't have to try and park or pay for parking. If they're not feeling so well, they're able to do that in their own home with their own family. It's something that's used a lot already, and we were certainly going in that direction. But one of the things that this situation has done is sped up that for us, and we've managed to really embrace it and make some really exciting changes.
I think you're saying the kind of innovation that's come out of not just your trust, but across the board has been really, really great with some of the digital stuff.
Yeah, absolutely. Yeah.
I just wanted to touch on, obviously, Simon Stevens wrote to Trust, what was it, a couple of weeks ago now. And he was saying that the demand for the aftercare and the ongoing support needs as a result of COVID-19 will be felt particularly acutely for community healthcare services. Even though we're sort of past the peak now, and hopefully we are, it's going to be it's going to be felt in a more sustained way in community services. Is that kind of something you're anticipating?
Yes, so we're anticipating that in different ways. So although we might feel we're over that peak, we still feel that as a community trust, we've got a lot to do to offer our population. We want to support our care homes and make sure they're safe, and that we are giving them and sharing the expertise we have around infection prevention, supporting them with swabbing in the care homes, education, how to use good infection prevention. So that's sort of our immediate work. And then longer term, we're looking at what's going to be the impact of COVID on our population. What will be some of the things that are left with people? And it may be they've got long-term lethargy or respiratory problems. So we're already looking at all the evidence, understanding what that impact might be, and starting to look at how we redesign or design new services to support the population. So we meet daily. We've met daily since the beginning of this, twice a day, to look at all the risks. And where at the beginning we were very much in a day looking at what's the risk for today, that scenario we've got now, we're looking to the future and what do we need to do differently to support the population of Norfolk to make sure that they're safe and they've got the right services.
So there's obviously people have had to kind of drop their day jobs in a way and kind of focus on the ongoing planning for COVID-19 really. But in the same letter, Simon Stevens, he was also saying he's asking trusts to start making judgments about the capacity for some of the non-urgent elective treatments. Are you anywhere near in a position to start considering that, or not really?
So absolutely, we're already well into our planning phase of how we bring services back in, what's important, what's our priorities, what's safe. So everything we do, we have to think that can we deliver that safely for our patients. We're working across the system about ideas about how we cohort patients, how we ensure that we're aware of patients that we're treating. And certainly our services, we're discussing every single service as a risk assessment, and we're working through those plans to get business as usual up as quickly as possible. Obviously at the same time, constantly thinking about what's safe. And we also want to encourage our residents of Norfolk to come forward and come into our units, also go to the acute trusts, because we know people didn't turn up at A&E, people perhaps didn't present with worrying symptoms, and there's been a lot of national campaigning around asking people to come back. We are open for business. We want people to come and talk to us. We don't want people to worry at home. So we are open for business, and we will be, as we go, slowly looking at the right pace when it's safe to open services. And where we haven't had something happening, we've always got something else that we can offer. It hasn't been that there hasn't been a service there for people. We try to prioritise, and we know for some people it's been frustrating, but certainly we're working hard to look at where we can open.
I think that's a really important point actually, around making sure you still attend your appointments. It's happening across the board, isn't it?
Yeah.
Whether it's people not wanting to kind of feeling like they're overburdening, but they're not really, or just obviously concerned about catching the virus there.
Yeah.
But yeah, it's an important point. I'll just ask you a couple more, and then I'll leave you to it. You've already spoken about the kind of digital technologies that you might be able to take forward as a result of this, but are there any more positives or lessons that you can possibly take that might help the trust going forward?
So I think, as in all these situations, I think teamwork is incredibly important, and we are a very big, geographically we're very large. We're not massive as a trust, but we are geographically. So we've used technology around meetings, virtual meetings. So it's made connection, we really worked at how we have virtual meetings. So we will definitely carry that on, save people's time, get together when we need to around a table. But going forward, we see virtual meetings as a way forward for the time being, particularly around safety. I think team working, people have worked amazingly together, a real can-do attitude, anything goes. Many of us have gone to 7-day working, so our executive team have all worked over 7 days, and we've spread ourselves throughout Norfolk, so there's a director presence in every locality, and we see that as a positive. So going forward for at least a while, we will consider, so for a lot of the time I'm based in the north at North Walsham at the moment, which means I've got contact with that part of our community and our nurses and our therapists, and then our CEO's been in the west, so that's been a really good thing, and we've reflected on that as a group of executives and said this has been good, this has given us visibility in a safe way as far as possible. I think we've engaged really well as a system, working with our CCG, working with primary care. I mentioned about our discharge hubs. You know, we've just completely come together, sitting together, doing whatever's best for the patient and delivering the best service we can. So this works very much around the new model, around the long-term plan, primary care networks, where we want to look at the health of the population in that area. So I think the work we've done, say Norfolk, where we've all worked together, this will only stand us in really good place to all work together and to, you know, work across boundaries. We were doing well anyway, I have to say, but I think this will accelerate that work.
Yeah, absolutely. As you say, we're all very well acquainted with Zoom and MS Teams now as well, so long may it continue.
Yeah.
And is there anything, just as a final sort of closing point, is there anything that you feel it's important for the public to know, or any kind of messages you'd like to give them?
So I think the public have been amazing, and I think they've been very patient. We've kept our doors open. We've listened to complaints when things haven't gone right, and we ask people still to raise concerns. Don't not raise concerns because you think we're busy. Please let us know, because we can't improve services unless we know something isn't right, and that's really important to us. As you can imagine, our staff have been incredible, working really, really hard. We've had people redeployed, that clinicians, and they've gone out of their comfort zones, got some sort of update training, and then gone and worked on the wards. So they have been incredible, and I'm grateful for that. But I think the main message is, you know, we are open. We want to serve the community. We want people to come in to our clinics. We will only ask you to come in if we believe we are safe. But your health is really, really important. So don't sit at home worrying about something. Phone your GP, phone your community nurse who you would normally talk to, and we will provide that care for you.